2004 is an exciting time in cosmetic dermatology. We can now achieve many things in anti-aging that previously required cosmetic surgery. We can improve lines on the upper face and the lower face. We can fade away discoloration and get rid of redness on the face. We can even actually tighten skin, something that clearly required cosmetic surgery in the past. Over the next few minutes, I'm going to explore some of the newer techniques that which achieve all of these different goals. As you watch this tape, what I would invite you to do is to look at your own skin and decide in order of priority what the most important things are that you wish to achieve. In this way, we can help you to achieve the look that's right for you and to choose that procedure which will serve to meet your goals. The best procedure for upper facial lines is Botox, a remarkably effective and remarkably safe procedure. I served as one of the original training sites for the company that makes Botox and have a tremendous amount of experience at using the product. We typically see somewhere between 15 and 25 patients per week for Botox treatments and have done so for about the last 8 years. The main side effect that people are concerned about with Botox, eyelid or eyebrow droop, occurs in my office with incredible rarity. I have not had a case at all over the past 5 years, and it is very, very uncommon. The results, on the other hand, are oftentimes outstanding and cannot be achieved easily with any other technique. With Botox, we can increase the lift of the eyes and give a little bit of a brow lift. We can eliminate horizontal forehead lines. We can eliminate frown lines or squint lines. We can improve crow's feet, and we can also raise the corners of the mouth when they are pointed downward. All these things can be done very easily with a very short visit, and when you leave the office, nobody will be able to tell that the procedure was done. Improvement generally occurs over a 2 to 10 day period, and about 1 out of every 10 times people will need to return at 10 days to get a little bit of touch-up done, which is very, very inexpensive. The improvement usually lasts 3 to 6 months, and in those rare cases that it lasts less than 3 months, we will do something to make it right, which we can talk about at that time. Botox rarely causes side effects, and the side effects that I do get are usually limited to bruising, which we minimize by using ice to ice you down before the procedure and constrict the blood vessels so we're less likely to hit them, and to mild headaches for which aspirin or Tylenol can be taken. For lower facial lines, we now have a couple of new fillers that we are using. Restylane is the most exciting of the new fillers. It is a product that can fill in deeper lines on the lower face, such as the ones that go from the nose to around the mouth. We can also increase lip size and thickness for people whose lips are thinner than they would like. This procedure again is very safe, and it is much preferred to the previous collagen that we used to use. Restylane lasts twice as long. It gives more dramatic improvement. It is more forgiving. You can massage out little lumps and bumps that are not quite right. It tends to last an optimal appearance through almost its entire life. In other words, collagen used to go down in improvement over time. Restylane stays pretty much at its maximal improvement through 9/10 of its life period. In addition, it is not a foreign protein and will not cause allergic reactions, and it's much easier to use. If somebody likes the effects they get from Restylane, there is now a longer lasting filler called Radiance, which is a calcium material that has not yet received FDA approval but has been used for a number of other medical functions. This has been used by the plastic surgeons now for several years and appears to be a safe filler and will oftentimes last 2 years or even as long in some cases as 5 years. However, if you don't like the look with the filler, you're stuck with it for 2 to 5 years. Therefore, I recommend to most people to start with Restylane, and if they like the effects, they can move on to Radiance. Radiance is more expensive, but it also tends to be more cost effective because of its long life. We now have an exciting new tool for tightening facial skin non-surgically, a realm that used to be only done by plastic surgery. The Thermage or Thermocool procedure, which has been on Oprah recently, and you may have seen it, is a procedure which uses harmless radio waves which heat up the deeper layer of the skin, the collagen, partially denature it, and as it tightens over a 6-month period, so does the skin. This procedure can produce about 1/3 of what a facelift does and do it just as permanently as a facelift with no downtime, and you look exactly the same as when you came in when you leave the office. The procedure is good for giving a brow lift, doing a tightening of the mid-facial area to get rid of deeper facial lines, and for getting an improvement in sagging jowls. It gives an excellent response in many individuals. Some individuals require a second treatment 6 months down the road, which we do at a very reduced cost if they only get a partial improvement. There are some individuals that it doesn't work well on, and those individuals we usually offer some service of at least half the value of the procedure so that they feel that they are walking away with something of value. The procedure that we use for fine lines and wrinkles are our peels. And we have two versions of our peels which are most popular. The A-peel is something that we make up ourselves in our office. It's found only in this office, and we based it on European studies where Retin-A was used as a peeling agent. We've done them very safely for a number of years now. The Retin-A peels will improve fine lines and wrinkles. They will also fade mild facial discoloration, and they're meant to be done about monthly over a period of time to get optimal effects. The procedure is very reasonably priced, and about the only side effect is some mild peeling you get a couple of days after the procedure. If fading is not an issue, our most reasonably priced peels are our glycolic peels, which we have been doing for years. We have two of the best estheticians in the country, and they're known for using full-strength glycolic acid and doing it with less irritation than with a salon peel, let alone the redness you usually walk away with out of most doctors' offices. They're extremely safe. They give a slow, gradual improvement in fine lines. They leave a nice, healthy glow to the skin, and they can improve gradually defects such as acne scars over time. These are also done about monthly over a period of time and are very reasonably priced. For those persons wanting the strongest peel that we have, if they tolerate A peels, one of our estheticians, Brad Stroden, has developed what is called the abrasion peel, where we mix our A peels, the peels that use the active ingredient found in Retin-A, and we mix them with microdermabrasion, which gives even a more significant effect. For prominent facial discoloration, such as age spots or liver spots, or for facial veins, we use our Photoderm laser, and I use laser in quotes because our machine is really safer than a laser. It's an intense pulse light. It is the most effective machine on the market for facial veins with about a 90% success rate, and it is very effective for pigmentation on the face with an 80% success rate, and is one of the most effective hair removal lasers on the market. Our nurse, Ann Osborne, was part of the multi-center trial when we did it for the FDA before this machine was on the market, and she has been operating this machine safely with an unsurpassed safety record for the past 8 years. The procedure is reasonably priced, and aside from a little bit of redness after the procedure, which can be covered with makeup, there really is no side effect of mention. Appointments for our procedures can be scheduled directly for Botox or Restylane with me, for Photoderm laser or Thermocool with our excellent nurse Ann Osborne, or for any of our peels with one of our excellent estheticians, Brad Stroden or Victoria Miller.